Good. All right, tonight is Tuesday, February 10th, 2026. Hereby call this meeting of the Plympton Board of Health to order at 17:32 hours. This meeting is being recorded for public viewing by Area 58 Community Access Media. Recording is not considered an official record. The approved minutes of the meeting will serve as the official record of the proceedings. First on the agenda, approval of meeting minutes from January 27, last meeting. Everybody seen those?
Yes.
Is
Yes.
there a motion? Motion to approve?
Make a motion, we approve the meeting minutes.
Second?
Motion and a second. Discussion on the meeting minutes from January 27.
None.
None.
Hearing none. All those in favor?
Aye.
Chair votes aye. Motion carries unanimously. Next agenda item, we'll just go out of order. We have Cape Katie's Express with shake machine failure on January 7 and January 13. And I believe 3 passing ones since then. So January 21, February 2, February 3. So we'll hear from you guys.
Okay, well, our purpose, of course, being here is trying to figure out and get it going in the shake machine, so, you know, I mean, we don't want to go against anything that the Board of Health reports.
Yep.
And our goal is to ensure that the procedures are being done to make sure that it's sanitized and properly cleaned, which clearly we've had some trouble with. Not for lack of trying, we have,
Yeah.
Joe has been in there doing, you know, been trying to determine what is throwing off, the testing on it.
Mhm.
And we've been through some different procedures, trying to figure out, you know, where it's coming from and what the problem is. Because we do have different locations that have machines and we haven't had a problem. So it's been really, I guess, hard and like we just haven't figured it out.
Sure.
But
Okay.
we might have gotten there,
Maybe, yeah.
Joe has been working on it, so I'm gonna let Joe explain how he's gotten to where
Well,
we are
first,
today.
I brought the test reports from the other locations, so you can see that we've had no issues.
No failures
in the
on
same
any
time.
other location.
We had, at the very first one we did over a year ago, when we first started testing, the first one failed in Plymouth.
Okay.
Nothing since then. It's been really good, and I have that here.
And you're the one that takes the
I'm the
samples too,
only
right?
one who
Yeah.
does
In all locations.
all the locations.
And
We
they
didn't
all-
start like that, I had an assistant who was doing it with me, but we kinda stopped that.
Okay.
So it just left me.
And they all go to the same testing facility?
They all go to the
Yeah.
same testing place.
Yeah,
Right?
And then.
We've actually had the water tested too,
Okay.
to see if
Yeah.
Oh,
that
that's a
could
good idea,
be
yeah.
a possibility.
yeah.
There's water in the, oh, you use water to wash.
Right, yeah, the cleaning stuff, I mean,
That's
the
public-
landlord
That's
tested
a
it
public
monthly.
water supply well, yeah.
Yeah,
Yeah, I know that the landlord tested it on his side, but we did it
Yeah.
on our side too.
yeah, we tested it,
Just in case.
we've gone, so we have the dish machine, like the, you know, and then we have the 3-bay sink that we've used too. And so we had the water tested coming out of the 3-bay sink area, because that, they usually test them at a different area.
Okay.
Just to, I mean, we're literally trying to figure out
Yeah.
Yeah.
like any connection we can.
Now, originally, we were doing the cleaning through the dishwasher,
Okay.
figuring that'd be the
So
best
machine
thing.
parts would come out, they'd go in the
They'd go in there,
dishwasher.
right, but we're still getting failures with those.
Yeah.
So we actually, I stopped using the dishwasher, almost, about a month and a half ago. We haven't had fails since then,
Okay.
okay? I don't know if you actually got the one from yesterday that passed too.
She had one, February 3rd was the last one, so I don't know if that's a test
I think
date.
that might be it, yeah, that's the
Okay.
first one, yeah.
And has the machine had product in it since the January 17th test?
Oh, yeah,
Or
we,
21st?
after a test, we change out the product,
Okay,
you know, and start fresh again. So
okay.
this
Try to
is,
test
the
again.
only one that wasn't like that was last week, I brought the sample in on Monday,
Yep,
but you guys also requested that they come and take the sample.
yeah,
Right.
Okay, they did that on Tuesday,
okay.
okay? so
And both
there-
were passed.
They both passed, there was no
Were they
cleaning or
close?
anything in between, no.
Were they close in
No,
results?
exactly the same.
Exactly the same,
Yeah.
okay.
Are the machines the same in every location?
Yes, it's the same make and model.
Just trying to figure.
Yeah.
And the one in Plympton's the brand new one, isn't it?
They're actually, I'm not, cause we
It says on the
replaced that one.
timeline.
When we had this initially, we had a
August.
problem.
Just, yeah.
We took out the machine that we had the problem with and put a second one in. that
Yeah,
we
August
had.
Right.
16th that
And
was.
then
And then we had
continued to have
three,
problems with a new machine.
we had three
Right.
we had three passes. The first one was close, but it passed, so
Right.
3 passes, and then the failure was November.
Yeah, when I wasn't here. I was in Vegas. That's when Steve did it. That was my assistant. That's when we stopped him from
Okay.
doing it moving forward.
So are you thinking maybe then that something with the dishwasher is causing a contamination?
That's what we're thinking. We actually had the guy come in and recalibrate it this week.
Yeah.
And he found that the sanitizer was way high,
Okay,
okay, and the soap was high. Not as high, but it was still high. So he actually recalibrated it and
and
stuff.
did he think that might cause the skewed results, or?
I didn't- wasn't
Yeah, I would think if the sanitizer were high, it was high, it would be the opposite, right?
I would think, but also when, I think it was like a month ago when the first fail test came in, we had the company come back
Okay,
and re-clean them again. And he told us that we shouldn't have been using the sanitizer that's at the sink.
okay.
We should be using this thing over here that he showed me, that we actually bought some from.
So
Which
it's
is a
right.
specific product for
Right.
that?
It's like a no rinse sanitizer.
Okay.
That's made for ice cream machines and stuff.
Okay,
Right.
And we've started using that.
all right.
Um,
Do you have any comments, Kevin, or?
No, I mean, it's just, I had even mentioned to Kathy before that I was wondering if the source of water was an issue, but you've tested that.
Right.
The dishwasher, hard to say, but, no, it's
Frustrating.
perplexing.
Yeah.
quite honestly.
It's very perplexing, that's the word I was
Yeah.
looking for.
Yeah.
You
It
say
is,
you've got
it's
one place
just-
that works fine, and one place it's spotty.
Yeah.
I also, the agent in Carver, and I get, reports from the,
McDonald's.
McDonald's, and it's always passed. And you would think that would be like, they're paying probably a lot less attention to their
Yeah.
machine
Right.
Yeah.
than
Yeah.
what you are.
Yeah.
So that's why I was just kinda, it's, I mean.
We thought that we had the company come out for the dish machine, calibrate it, and so we thought that we would test with the dish machine, right,
Right.
Joe? That
Yeah.
would be
We
the
were gonna
next
go and do
thing.
that the next test.
And the next test, try it, having used the dish machine now and
Okay.
see.
But if we did that, we would've let you know ahead of time.
Yeah,
Yeah, we
We're gonna be
wouldn't-
doing
we're-
that, so you
yeah.
know.
This is gonna be our variable we're changing. If
Right.
this failed test result, then we can kind of pinpoint it to that.
Right, yeah,
I can't think of anything else. I
No.
mean, you've had 3 past tests in
And
succession.
we have one in now.
Yeah,
There's one in submitted.
yeah. So, I mean, I think you guys are doing your due diligence and trying to track down the problem. I mean, you kind of eliminate variables. It's not the water, it's not the machine, because you changed
right,
that out,
changed the
tested
machine.
the water.
yeah,
And
So,
you've been responsive in the past, taking it out of service. when
No,
you-
as soon as we get a
Yeah.
fail, we take it out.
all right, well, just keep us posted with things if you do identify an issue. If you're gonna send that test after the
Right.
dishwasher, let us know.
okay, yeah,
But
definitely.
I think
Yeah.
we're good with that at this point.
Yes, I agree.
Okay,
Okay.
well, thank you. Appreciate you
So
coming
we're
in.
good to go for now?
Yes.
Thank you.
Yeah, yeah.
I know it's been,
Yeah, no,
You know.
I mean, if it comes up again, we'll keep working with you, trying to
okay, yeah,
make this as painless as possible.
Yeah.
there you go, I know, it's tough having it down.
Yeah,
People like their shakes.
maybe not when it's 5
I had
degrees.
You know?
2
So
dozen
you'd
of
be
them last year.
surprised.
Well,
Yeah.
we're still in iced coffee state at 5 degrees. I guess milkshakes
Yeah.
is popular too, right?
Yeah, yeah,
All right.
thank you very much.
Yeah,
Thank
Yep,
you.
Thank you.
We don't let it mess you.
Thanks, you too.
Take care now.
Thank you.
All right, so that takes care of that issue. I'll give you this back to file for them, Kathy. Is the TV up and running yet? Waiting on some cables?
Yes, the cables just came and
great.
the IT guy will be here Thursday.
Okay, so plans tonight, we still have to display paper if needed?
Yeah,
Okay.
we're going old school here.
All right.
Kathy, you should change your desk so you can sit there and watch TV.
It's not television on there, Kevin.
Oh.
I'll get you a Fire Stick next budget year.
Stop.
All right, so I will turn it back to you, Kathy, if you want to run us through the agenda in order.
Okay, yeah,
dispense
page
with that.
1, the last one down, 0 West Street. It is a repair of a septic system. This is a really interesting property in that it is partially in Plympton and partially in
Oh, yeah.
Halifax.
Okay.
In Halifax, they call it 6 East Street. We call it 0 West Street.
The Blueberry Farm?
Yes.
No, on the other
is
side.
it? The other side.
Other side,
Yeah.
yeah.
So,
Yeah. I think the septic is in.
the original septic was in Halifax. But it failed. And when they went through the process of wanting to replace it, they have now decided that they're gonna put the replacement in Plympton. So, anyway. Plans came in, plans went out to the reviewer. Kevin has looked to make sure that all the review engineer's comments have been captured in the revised plan, so if you wanna stamp them, there is one variance, it's just to allow a sieve analysis instead of a
Okay.
quick test.
All right, so, and I will take a motion on the variance first.
I make a motion, we approve the variance.
Okay, so we have a motion to approve the variance for
Second.
0 West for a sieve analysis instead of a perk test. I have a motion and a second, discussion.
Oh,
Hearing none, all those in favor?
Aye.
aye,
Chair votes aye, motion carries. And then our plans, those, you said those have gone through review, comments were addressed, so is there a motion on the plans?
make a motion, we approve the plans.
I have a motion to approve the plans for 0 West, is there a second?
Second.
Motion and a second, any discussion?
No,
Hearing none, all in favor?
aye,
Chair votes aye, motion carries. I will give that to you for signature. Time for a new stamp? Oh, you were on a
I
whip.
think I was on
You were on a whip.
Here's old school.
the ledge. Harry would be happy.
Number 1. This would be so easy when we just have digital signatures on electronic plans.
That's better.
That one was much better, but I'm gonna entrust you with the next one, because you did so good on that last one. Oh, I'm sorry. Slacking on my duties. Plan sander. Plan sander?
Hmm?
Plan sander? Plans hander, not plan sander. I'm handing him the plans so he can sign it. Plan sander.
Shall I change your
Title?
title?
Please. We should have at least one gag name tag in there. That was it for the first page, Kathy?
Mm-hmm.
We getting to the point where nobody's digging, huh?
Yeah.
Nothing going on.
No. At least be March, I would think, with the heavy frost we've had.
I mean, there's still.
Well, the snow does insulate quite a bit, but even so.
a nice light agenda.
Yeah. I know that, Facebook.
Yeah.
Somebody actually just arbitrarily asked if anybody knows if Long Pond in Plymouth is safe to skate on.
Try it.
Right.
Where the hell have you been?
Very
Last
safe.
month and a
Very
half.
safe to drive on.
Yeah, I know, it's like, oh,
Alright, page
Okay,
two,
page
Kathy.
2.
Even that's not where you get the information.
yeah, exactly.
Fourth one down, 23 Prospect.
Yes.
If you remember, and this has been going on for a little bit,
Yeah, I saw your email.
23 Prospect, Mrs. LaJoy called Wind River to have her septic system pumped. They pumped it in November, and on the pump record it said, system is not at proper working level, it is over full, and there is a visible run back from leach field. So she came in and she was concerned. And, trying to think of what we did next. She talked to them,
To Wind River.
to Wind River, and, they said it was fine.
Okay.
When we talked about it here, you would ask me to send a letter to Wind River
Just have them send a revised.
to have them send a revised record.
Yeah.
Well, they didn't do that, and then Mrs. LaJoy came in on February 3rd to check on the status, to correct her pump record, because
Mhm.
she was very concerned. She's
Sure.
like, either I want a correct record, or
Yep.
I wanna see what's wrong with my system. And we had sent it to corporate and Wind River Carver, but we didn't hear anything. So I told her that the matter was on our agenda for
So we
tonight,
still, when did our letter go out to Wind River?
in December.
Okay, we still haven't heard anything back from them.
So,
Oh, the story continues.
the story continues, I'm sorry to say. On the 9th, which was yesterday, I received a phone message. And the way the system works, if I'm on the phone or if I'm not here and the message comes in, it types it up as an email.
Yep.
So, we got an email from Steve McFawn from Wind River, and it says, "Good afternoon, I'm writing in reference to the miscommunication. Unfortunately, the tech hit the wrong option when answering the standard questions asked during routine services. Once I was alerted, I, as a local supervisor and Title V inspector, went to check it out. After receiving your letter, the system is working as designed and no past problems were seen. I apologize for the confusion."
Yeah, that doesn't cut it.
Yeah, you would have to
The
submit. its
Title
own-
V is the official record of the inspection.
Well, that's just a pumping record, it's not a Title V.
Oh,
It's just a pumping record.
it's still a, is it a, oh, I guess it's not a,
I mean, a pumping record is not,
yeah.
it's not really a report, if you will, it's just,
You see that?
the reason why they started requiring the pumping records to be submitted to the town, so that the towns can see if pumping is being done at a rate greater than 4 times a year.
Right.
And then be able to identify a failure. So, I mean, whatever you guys want.
Yeah, I think they gotta correct this.
Just correct the pump, you know.
Yeah,
pump
we gotta get, this,
Yeah, yeah.
this on file needs to state what he said, or it's still considered a failure. I'm not sure, but is there a system you're aware of that you push a button and it writes a 5-sentence narrative? I would think the pumper would have to actually
I don't.
type that in.
I don't know.
I'm sure the box, yes or no, is
Yeah,
the
yeah,
one, but
yeah.
it's still, somebody still physically wrote, cover was accessed and 5 other sentences
Yeah,
of
yeah.
what they observed, so I have a feeling either they wrote the wrong report for the wrong property,
Yeah,
or
that's a possibility.
this was the problem, but I think they've got to officially send us a revised record. Would you,
Yeah, absolutely.
Discussion
I
on
think in
that?
the
Yeah.
meantime, we should attach his email to that and,
Just
Un-
unbutton the.
yeah, if it's as easy as clicking a button,
Yeah, right.
unclick the button
Yeah,
and
right,
send it back.
exactly.
with your name and signature of license title.
Okay, I
whatever
told her I'd
license
call her
title.
tomorrow, so.
Yeah,
we'll just
yeah,
report
that doesn't
to her.
undo the description you have.
Yeah, you can't
Yeah.
have a,
I mean, you can't just attach the voicemail email to that.
Right, I mean, that's not a,
Because it explains it away, but it just doesn't correct the document itself.
correct,
so.
yeah, so we just need to, they need to correct
It's
this.
not a big ask,
No, I don't think it is.
no.
yeah, it'll make her feel a lot better.
Yeah, does he have, is that his direct line on there? Alright, maybe, okay. Do you mind reaching out to him tomorrow? And just let me know if there's any issues with that, but I think that's a fair ask for them to fix that record.
So similarly,
Similarly,
you know what I mean,
Photo?
we had a similar issue at 76
oh, up on
Upland
Plum,
Road,
yeah.
where they had their,
Broken cover or something?
they had
Yeah,
their
but it
system
was.
pumped
It was.
by Wind River
Yeah, it
again
was.
in November. And it says there was a safety concern on site that needs immediate follow-up. Cover was accessed, but it didn't say what the safety concern was. So I called Wind River Corporate and I said, is this something we need to worry about, the safety concern? And she said to me, oh, I see a picture that the cover is cracked.
Mhm.
So I said, okay.
Okay,
We'll let you chime in
good.
then.
So it was the main office in Marlboro. She said one of the rear covers had a chunk missing and looked like a safety hazard. She said she would contact Carver, Wind River, and have somebody call us. So Wind River did, again, another voicemail from Mr. McFawn that says, I'm calling about 76 Upland Road. Mike had made a mistake when he clicked the wrong button, triggering it to say there's a safety issue. There are no safety issues over there. So then Kevin went out and
Yeah.
inspected, and you found that the covers had been replaced.
Yeah.
So, which is it?
Yeah,
Either there's no safety issue to
I'm
begin
starting to
with.
see a trend
Yeah.
of buttons being pushed incorrectly,
They got too many people,
yeah,
too
too big, too fast.
yeah.
Uh-huh.
It was probably cracked,
Yep,
and, because any business that's in that business, they look for things
Sure.
to repair.
more money in the service calls than there are in the pumping.
Well, I mean, I think the point is, if, you know, if corporate says it was cracked, Kevin went out and saw it and it was cracked, then why am I getting an email that says
Well, no, I
push
saw
wrong
that it
button?
was replaced.
Right.
Yeah, replaced, yeah. So why am I getting an email that says somebody pushed the wrong button, there's nothing wrong?
Yeah, that's a little concerning.
I don't
Is
know.
it two different people who have the wrong button story, or is it the same person who don't?
Well, see, that's it, I don't know who the pumper is.
Yeah, the same supervisor answered.
No, the person with the
All right,
wrong button
all right,
was.
so this hauler here, his name was Jim.
I don't have the other one anymore.
Let me see.
But it's not the hauler, it's the fixer who's the wrong button
Yeah.
guy.
Isn't the hauler the guy that goes out and
I think
sets
the
it up?
pumper's filling that report, and that's who they're
He's
saying.
filling
is
it out
looking at
correctly.
wrong.
Yeah, and this other guy's name is Elder. First name Elder.
Okay.
So,
Gotta respect your elder.
Yeah. Rumbumps.
so,
All right.
you know, I don't know, I don't like this kind of.
No, I think a little honesty goes a long way, at least in my book, especially when people are out working unsupervised under our regulations, so.
So,
Yeah, maybe, why don't I give,
I can get you the information to call the local window
yeah,
office.
let me call the local office and I'll just
Okay.
explain to them our problems with the last two answers we got of improper button pushes, and that we really do generally like to have factual and accurate information being provided to us. We don't have any authority in local to, well, they have to get a pumping license from the town, right?
Hauler's license
Hauler's
every year.
license, okay, well, I can make it clear that any more discrepancies and that just won't get renewed next year by vote of the board.
Nope, I
We
will
don't,
send
we
you-
just don't have the staff to watch everybody when they do stuff, so if they're not gonna honestly self-report, then they can do it somewhere else. Would be my feeling, I don't know what anybody else thinks about
Yeah,
that.
I would concur.
Yeah, that
Yeah.
seems reasonable.
Okay. Under new business, Zero Palmer Road, this is one of Scott Sawchuk's properties.
Mhm.
Oh,
He
yeah.
has, had sent in a plan for installation of a new septic system, so that is now out for review.
Okay.
So I would imagine that it will be back in time for you guys to approve it at the next meeting.
Mail time.
Mail is next.
Are we
Okay.
losing a mail? Are we losing a mail?
Yeah, we listen to MALE.
Thank you, Kevin.
You're welcome, I'm not.
Good night, guys.
I'll be right back.
Okay, we,
Do it all at once.
Yeah.
Yeah, go out the front door.
Yeah.
Yeah,
Good idea.
thanks.
good to see you, Kevin.
I felt very unsafe, very unsafe.
We'll get
Not
that,
being able to get
we'll
out.
get that corrected, don't worry.
All right, see y'all.
Phone,
Have a good
coffee,
night.
please.
Got it. All set. Thank you.
Okay, we have a copy of a letter from the town administrator to the Plymouth County Mosquito Control Project, South Meadow Road in Plymouth, and she grants permission to Plymouth County Mosquito Control to fly over the town of Plympton to apply
Not now.
mosquito larvicide to the wetlands by aircraft between April 26 and October 2026. So,
Mosquito control requires permission from each town, so they like to get it in writing early,
Good plan.
while we can dream about mosquitoes.
Yeah, maybe on the air service.
and we have our monthly appropriations and expenditure report from the town accountant, and which shows, short of escrow and the septic grants, that we are at 47.85% of budget,
Which is under.
which is under.
50% was December 31st.
Yeah,
We're all
so
under.
Yay, us.
Yeah.
we're almost a month and a half.
Good.
Well, this was as of February 4th, so we're seven,
Way under.
yeah, we're 7
The
months
The
under.
bill for the electrician might get tagged to us, I assume, when it comes in. Yeah.
How much of a surplus
I wasn't
is that?
expecting to pay it.
So now we're probably like, I think it's every month. Every month is like 8% of the budget, so we should have been at 50 December 31st, so 58, 60 range.
So
so
we're
we're-
48, so 8,
12% of our budget's what?
50%.
3,000, 4,000? But of course,
Yeah.
wages and personnel are probably spot on, cause that's pretty steady through the year. It's just the expense stuff.
And including escrow and the septic system grant, we're at 43%
Good,
of our budget.
okay.
So we're in good shape.
Well, and we've spent some money in terms of doing some improvements here and getting things done, so that's all good. To get some improvements here, I know this office hasn't been looked at in a long time, so it's nice to see it getting some attention finally.
Okay, and we have a save the dates from the Massachusetts Association of Health Boards.
Yeah, just is there any interest in the three of you? Does anyone wanna go to this, framing? That's
There's
all.
one at the 1620 in Plymouth. The others are in Holyoke, Marlborough, and Danvers. And tentative programs include Board of Health Legal Authority, Public Records, open meeting, conflict of interest laws, holding public hearings, nuisance actions, and those are case studies. Those are usually pretty interesting. Opioid abatement funds, best practices, and other environmental issues, the public health excellence program, sustainability, and housing issues, and what's coming down the pipe, including recent court cases and cannabis social consumption regulations. So Those dates are coming up. And I believe there's grant money available.
Grant will pay for board members only. So they don't pay for health agents or administrative assistants.
And I'm gonna jump
You gonna jump ahead?
yeah, only because it's tangential.
After I spent all day putting those in date order.
Well, this pertains to that, so, yeah, we got a nasty gram from, what is his title at the MAHB?
Does he have a title?
Director of Strategies and Government Relations.
Oh. I guess
Yeah, and
does.
he kinda,
And who's that?
Michael Hugo, JD,
Oh,
friend probably.
what's his issue today?
Well, he kinda sent a very strong that we need to do it, and it's in large type.
Oh, yeah.
Um,
People that use bold and underlining emails,
Yeah,
they generally just
so-
ignore.
And then somebody called him on it.
and somebody called him on
I
it.
doubt it.
And so then we got a toned down, oh, sorry for any misunderstanding. So, but
Yeah.
bottom line, that's all this is.
He wants us to go to
Make sure we
Board of
attend
Health
that.
school.
Make sure we
Yeah.
attend that
Well,
certificate.
yeah, saying that the boards must get all these
Yeah.
different certifications and this and that.
Yeah.
That's not accurate.
I
Very-
checked my contract, there's nothing in there.
Very firm.
Well, you do get that dollar.
I haven't seen it yet.
Yeah, we haven't, I haven't seen it in 12 years.
I went to one and I didn't get any certification. I
They
forget
should
what
have
that
sent
was.
you something. They should have sent you something
Yeah, they usually,
afterwards.
do you check your email? They usually send you like this certificate or whatever.
A certificate I have to print out and
Yeah.
Well, there's an
Awards
email
myself.
address on there if you want to inquire as to why you didn't get your certificate when you attended.
Oh, and you see in front of you with that sticky?
any interest?
No. It's another one. Oh, did you take that other thing that I had here that you know?
Oh, I might,
That. You can take that one
okay.
before I forgot.
Oh, you gotta sign that variance. I never got that to
Oh,
you, sorry.
okay.
I wasn't handing things appropriately.
No, so I won't change your title.
Okay, and now we have an email from the town administrator, regarding safety protocol and with 4 suspicious packages. And,
We got 4 packages that were suspicious in town.
I don't know, I just saw the email, I didn't hear any.
yeah, this was sent out Wednesday, February 4th, so a week ago tomorrow. It doesn't state anything in here that we've had any, but it said to be
Okay.
vigilant and,
All right.
yeah, let's see.
She must have the inside scoop on law enforcement stuff. Huh?
And they will do the testing of the panic buttons.
Oh, good. That's great.
So. And we got a very brief email from the assessor's office that 48 Grove Street was sold.
If you remember.
From the
we
assessor's
had,
office.
A complaint
Yeah.
Belleville.
about 48 Grove Street, about
Okay.
all the trash and everything. So the
Yeah.
good news is it has been sold and, as of, I think, last week or maybe 10 days ago, they were in there like just chucking all the trash and.
Good.
So, that's good.
And the last thing was the Southern Plymouth County Public Health Excellence Collaborative timesheet for the month of January, and we had 5 reported Lyme disease, 6 flu, and 4 COVID.
Okay.
So,
Ticks, they never had.
Yeah. That's why they call them ticks.
That warm day before the snowstorm, the dog was covered in them.
You just can't, they just go from. Alright, so that's
That's
mail.
all for mail.
that's it.
Warrants got signed.
Yep, warrants been signed.
Any grant updates?
No, the next meeting is in Wareham next week.
Okay.
So the good news, which I don't know if you weren't here, is VNA is coming back.
Oh, good.
Bridge
Yeah.
will serve the towns of Carver and Plympton. So it's just a question of getting them.
They're not doing Halifax or Kingston?
Some of those towns have nurses.
Well, I know Kingston does have a nurse,
Right.
but I don't know about Halifax anymore.
So, anyway, that's what we know about that. So we actually have two more things. One is Ricketts and one is the town, which is the report of the Board of Health. I'll do that one first.
Okay.
So you all got that, and I'm sure you looked at the report.
In the town email? I'll have to look at that. I haven't looked at it in a little bit, to be honest with you.
So anyway, it's just the report of the Board of Health is due on March 19th. And so I sent you guys a copy of the draft. And
Yep.
if there's anything that you want to add or change, let me know. Otherwise, on March 19th, I will submit it as written. Basically, there's nothing different than what we usually do, which is a little narrative about what's going on in 2025 and our, how many different permits we had and stuff like that, so nothing earth-shattering. Last but never least is Ricketts. Jared and I suffered, went to the ZBA hearing where they were supposed to start discussing waivers. But I don't believe we ever got anywhere close to discussing Board of Health waivers. After the meeting, I did talk to the chair of the ZBA and I asked him if he would please send me via email any documents that pertained to Board of Health. He did send the
Hydrologist?
Yes, that. The peer review, I think I sent it to you via email. Here's a copy if the rest of you want to look at it. And also, after my discussion with the chair of the ZBA, we received the updated list of waivers and exemptions that they're asking from local
Okay.
bylaws and regulations. The thing that concerns me is, and again, we can only talk about our regs, but they are asking that the project be exempt from all provisions of Plimpton's Title V supplemental regulations.
Okay.
The issues I have is some of the provisions are administrative as to how many copies of plans we need and things like that, and I don't think they should be given waivers on that. So the first one would be 15104, perk testing. They just will comply with Mass Title V perk requirements, and they don't want to follow our regulations.
I think that's been their assertion all along, right?
Right,
Pretty much.
right. Our regs do say that the soil evaluator and the agent for the Board of Health must be on site. So I don't know, I'll have to look into more what the state regs say, because, I think Kevin needs to be there when they do the test.
Yeah.
So
Yeah.
if that's not in the state regs, then we should waive it from what they're asking.
I think we could take without even bothering with the state regs, we could say, this one stands,
Right.
and just leave it at that.
Some of the other ones, obviously, they're not going to adhere to our 4-bedroom minimum, and not much we can do about that. The setbacks, they just want to do the state setbacks and not our setbacks, and again, I don't think there's much we can do about that. 15212 groundwater, which is also known as 5 acres. The 5 acre rule, they don't want to follow our regs. Under 15-221, we require all piping shall be a minimum of the Schedule 40 PVC, and they just wanna do the state 35 PVC. So I don't know whether we need to ask Kevin whether that matters, or whether we just,
When we had talked about having an assessment of our regs done at a certain point.
Yeah,
Where's that going or gone?
I sent a few emails to Liz and the Board of Selectmen, and it's kinda,
Stalled?
yeah,
Okay.
they kind
Maybe we'll
yeah, I think that would be
open that
wise.
discussion, cause we're probably getting a timeliness issue here if we're gonna do that.
Yeah, I think, all this stuff we should kinda put on the back burner until we can get some help analyzing.
well, when's the next ZBA meeting,
Yeah,
right?
or they said, I think the last one they said they were,
Is it the March 11th?
yeah, I think they wanted to give enough time for everyone to look through the report and,
Yeah,
but
Tick,
yeah,
tick, tick,
we've kinda been on our own for that,
Yeah.
and.
well, we should probably be able to send an email to the chair of the Board of Selectmen and Liz and say, this is what we need.
Yeah, do
And we
we
need
have an
it-
assessment of the cost?
We need it now.
Yeah, I think it was,
We can just
Good.
include that in the email.
yeah. I think it'd be less than whatever the quote was because the,
Hydrologist did a report already.
did part of
So this
it.
is isolated to that. Do we know when that hydrologist report's coming back?
I think it just did,
Did it?
and then we have,
I haven't read it.
GEI's, comments on it.
Right. And then the last one, shared systems, and that was, I mean, we removed that in the regs that you just approved, so, that's nothing. As I say, if I have two concerns. One is that at some point, the ZBA is gonna say, oh, we're gonna talk about the Board of Health waivers, and
Yeah,
we're not gonna be ready. And then the second thing is, I don't think that it's appropriate to waive any of our supplemental regulations that have to do with the process of how we
Oversee.
get plans in
Yeah.
and
Yeah,
send them
and-
out for approval. I mean, all that is in our regs, and I don't think they should waive that.
yeah, I think, Brad McKenzie, or whatever his name, McKenzie, he said, they didn't really dig too deep into it, they just were going for blanket waivers, so I think we absolutely should pare it
No
down.
thanks, no blankets here.
Have you looked at this? Had a chance to look at this?
But yeah,
Can you summarize it for me?
it looks like they didn't put a lot of thought into it, looked like they kinda,
Boilerplate.
it looks like it came out of like ChatGPT.
Okay. Should we maybe have the
Yeah,
person that's looking at our bylaws look at this as well?
yeah, we probably should have pinned Kevin down and see if he had gotten a look at that, but,
Maybe send that to him tomorrow and just
Mhm.
ask for his thoughts.
yeah, let's,
I know, cause we always talk about this after he's gone. You know, they should probably move it up on the agenda.
Yeah.
yeah, we can, I think this is fairly recent, so if we could have a little more time to go through it and just see how it impacts us, and then, we'll come up with something thoughtful to say.
Is there, when's the next meeting that was scheduled for
March
ZBA?
11th.
March 11th, okay. And do you know what agenda-wise is gonna be discussed then? And I know they've been pretty thorough agendas and stuck with the
I think,
plan.
is March 11th, did they say they were gonna tackle the, cease and desist on March 11th?
I didn't fully, was that, did someone say that was gonna end up being handled in court, or they said,
That was,
or,
that was
Or
a
they said ZBA.
preliminary discussion, and then it was decided that no, it would be handled at a ZBA hearing.
okay,
That was the final
I-
thing. So
I got a, yeah, it is coming up soon, but then I thought, because it was issued by building, that maybe it was gonna be through them?
That's
or-
what they said at first, but then everybody walked
Okay, so
back
it's
on
back to
that, and it's
ZBA?
back to ZBA. And until we see what the ZBA agenda, when that comes out. you know.
Okay, maybe just keep us posted on that kind of stuff.
Yeah, I just don't wanna be caught, us sitting there and then,
Yeah, sure.
you know, and Jared and I continue to faithfully, attend.
All right. Is there any other new business or business on the agenda? I think that was it, right?
That was it. The only other thing is our next meeting is scheduled for the 24th of this month.
Perfect. All right, if there's nothing else, I'd entertain a motion to adjourn.
Make a motion, we adjourn at 18:18.
Second?
Motion and a second discussion.
None.
All in favor?
Aye.
Chair votes aye, motion carries, meeting adjourned at 18:18.